Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. I want to discuss how our understanding of musculoskeletal care has changed and extended, and I want to discuss it based on an example of a patient that I recently saw. So the traditional understanding of orthopedic or musculoskeletal care is that it's all about structure. What do you see on an X-ray? What do you see on an MRI? And a more nuanced and a regenerative approach to looking at musculoskeletal care is that it's really more about the physiology of what's going on. So structure is certainly important, but there's more than just structural elements at hand. There's also issues including stability, inflammation, neurologic health, and symmetry. So as an example, I have a patient who has a history of psoriatic arthritis, which is currently under good control on treatment. He has chronic pain in his right wrist. In addition to his history is that he also used to be an amateur boxer when he was in college. So on his ultrasound examination of his wrist, he doesn't have any active inflammation. He doesn't have any erosive changes from psoriatic arthritis. But what he does have is thickening of the joint lining consistent with prior inflammation. He also has very mild instability when you're dynamically stress testing the radioscaphoid joint, consistent with likely laxity in a prior ligamentous injury. He has persistent pain despite some conservative care, so we end up getting an MRI, and his MRI notes that he has no active inflammation and that he has no significant joint issues, so that they can make it on MRI, but they do make a note that he does have a chronic sprain of one of his ligaments. So putting this all together, there's a couple different things going on in his case. Number one, he does have some chronic thickening of that radioscaphoid joint, of that wrist joint from his psoriatic arthritis. And he does also have instability in a few of the ligaments in his wrist as well. This combination of issues is what's driving his pain. So even though his MRI is only really documenting a minor sprain of one of his ligaments, we know that it's causing instability based on what we're seeing on dynamic stress test imaging via ultrasound. We also know that even though his MRI says that he doesn't have significant inflammation in the wrist joint, we know that he likely has some degree of chronic discomfort coming from that thickened synovial hypertrophy in the joint as well. So the approach to his treatment going forward is going to be using platelet-rich plasma to treat not only the wrist joint that's been chronically affected, but to also use platelet lysate, which is essentially the growth factors from the platelets, to actually treat the ligaments as well. The goal here is to treat not only his pain that he has in the wrist joint, but to also help thicken and strengthen the ligaments so that he has better stability long-term as well, because chronic instability will lead to progressive damage in that joint and more pain as well. The takeaways in this sort of case are there's more than just structure. There's sort of second and third order things that you need to understand. That comes from a regenerative approach to musculoskeletal care, which I think will lead to a better outcome in his case. Let me know your thoughts. Thank you for your time. Have a good day. Be well.